To strengthen your bones and stave against disease and infections, make sure you get your recommended daily dose of vitamin D. However, what would happen if you overindulge in vitamin D-rich meals and supplements? Well, going above your daily limit could be detrimental rather than beneficial. You did really hear correctly. Overconsumption of vitamin D can have detrimental effects. What harmful consequences result from taking too much vitamin D? We'll talk about everything today, from digestive problems to the effect on your calcium levels. Now let's get going. High levels of calcium. The largest risk linked to excess vitamin D is elevated calcium levels. The fact that vitamin D facilitates the body's absorption of calcium from diet is among its many benefits. That being said, your body will absorb far more calcium than it needs if you take in too much vitamin D. Hypercalcemia is the medical term for the state that results from having an excessive amount of calcium in the blood. Dehydration, and appetite loss, and digestive irritation could all result from hypercalcemia. Along with renal damage, cardiac problems, elevated blood pressure, and frequent urination, you would also suffer these symptoms. People who obtain their vitamin D from a regular diet do not develop hypercalcemia. It happens to people who take large amounts of vitamin D over an extended length of time. Therefore, you need to stop taking supplements without first talking to your doctor in order to prevent vitamin D intoxication. An elderly man suffering from dementia was given 50,000 IU of vitamin D daily for 6 months, according to a 2015 case study. Following this time, he was admitted to the hospital due to hypercalcemia-related symptoms. Another instance was a woman who took 130,000 IU of vitamin D daily for 20 months. She was admitted to the hospital as well, exhibiting signs of renal damage, acute nausea, and hypercalcemia. Her calcium levels in the blood were significantly higher than average. Because hypercalcemia can become fatal, it is important to treat it with caution. You should get medical assistance right away if you encounter any of the symptoms. If you believe that hypercalcemia is the only risk connected to vitamin D poisoning, you couldn't be more mistaken. The following side effect on our list is frequently misdiagnosed. Intestinal problems. Overconsumption of vitamin D frequently results in digestive problems. As was previously discussed, having an excess of vitamin D causes an abnormally high level of calcium in the blood. Furthermore, some patients may only experience gastrointestinal problems in addition to the typical signs and symptoms of hypercalcemia, which include nausea, constipation, poor appetite, and diarrhea. One woman had nausea and weight loss as a result of elevated calcium levels. She was taking a vitamin D supplement that contained about 80 times the amount of vitamin D recommended on the package. In a different instance, 2 siblings were using incorrectly labeled vitamin D tablets. While one brother just had elevated blood levels, the other experienced constipation and stomach ache. Similarly, 50,000 IU of vitamin D3 were administered for 3 months to an 18-month-old baby. The young person had symptoms like diarrhea and stomach ache. Once the baby stopped taking the vitamins, these symptoms went away. If digestive distress and hypercalcemia weren't enough, there's another potential risk that has a lot to do with the volume of your blood. Relax. Elevated blood counts. High blood pressure can be harmful. The amount of vitamin D that can be harmful to you is 100 nanograms, ING, per milliliter, in case you were wondering. Hypervitaminosis D, also known as vitamin D intoxication, is the diagnosis made when the vitamin D level is higher than this threshold. Aim to consume no more than 4,000 IU of vitamin IA each day. One man, who was 73 years old, was taking 10,000 IU of vitamin D daily when he eventually had vitamin D toxicity. A woman who had taken almost 130,000 IU of vitamin D daily for 20 months was the subject of another investigation. Her multiple sclerosis condition was something she hoped to better. She was admitted to the hospital, nevertheless, after exhibiting signs of nausea and muscular weakness. Her vitamin D levels were approximately 265 nanograms, milliliter, which indicated that she had become drunk. You might be surprised by the next vitamin D toxicity-related consequence. Regrettably, you would be surprised to learn how frequent it is. Relax. Problems with the kidneys. Kidney problems can result from vitamin D intoxication. Kidney damage brought on by toxicity can occasionally result in renal failure. Frequent urine results in considerable water loss due to elevated calcium levels in the body. Your kidneys can eventually fail due to calcification. Renal blood vessel constriction can also be brought on by high calcium levels. Your kidneys stop working correctly when this occurs. Studies have indicated that individuals with vitamin D intoxication experience mild to severe renal damage. There is no getting around the truth that vitamin D toxicity negatively affects your physical well-being. But is there a mental impact? Let's investigate. Relax. A vitamin D deficiency may have psychological effects. Some patients who overdose on vitamin D and develop hypercalcemia may show signs of despair, disorientation, and psychosis. In severe situations of hypercalcemia, you may potentially go into a coma. In one instance, a 64-year-old man misunderstood the directions for his medicine and started taking 200,000 IU of vitamin D daily. Along with other indicators associated with hypercalcemia, the patient displayed symptoms of disturbed mental status. Throughout the whole of his 10-day hospital stay, the man was confused and anxious. But his condition got better when the calcium levels dropped. In order to be released from the hospital, he had to wait little over 2 weeks for the calcium levels to return to normal. Relax. Managing deficiencies and toxicities. Handling toxicity and deficiency. Vitamin D supports immune system health, protects bone and muscle, and aids in the absorption of calcium. Vitamin D can be obtained from sun exposure or food consumption. Although most of the foods we eat are deficient in vitamin D, the only food that can provide you with a significant amount of this mineral is fatty fish. Nevertheless, nearly 50% of the world's population does not even have enough vitamin D to sustain their health, with over 1 billion individuals suffering from vitamin D deficiency. Your healthcare provider will assess your vitamin D deficiency and provide the appropriate amount to maintain your levels. Just be careful not to exceed recommended dosage and not to use too many over-the-counter supplements. Since toxins can affect your body, it's critical to understand what to avoid and the telltale symptoms of toxicity. So, let's continue the discussion with a few more videos. Must we see these 13 dangerous indices that your body is overflowing with toxins? Try our video on 16 strange foods that could actually kill you as well. Feel free to click one. Better yet, watch both to get more knowledge about maintaining your health and fitness. Do you keep an eye on your regular intake of vitamin D? Tell us in the comments section below. In brief, to have healthy bones and a long life, you need vitamin D. However, overindulging in pills isn't the best approach to obtain this vital vitamin. Excessive levels of vitamin D might have detrimental effects. The body needs vitamin D to properly absorb calcium from meals. However, doing so can result in hypercalcemia, which can induce an upset stomach, a decrease in appetite, and dehydration due to an excess of calcium in the blood. In addition, you would suffer from symptoms like hypertension, cardiac problems, renal damage, and frequent urination. It may surprise you to learn that mental health issues can also result from excessive vitamin D intake. Vitamin D should be obtained through natural food sources and moderate sun exposure. If you do require supplements, be careful to speak with a medical expert.